There is some promising news on the coronavirus vaccine front. Moderna says their COVID-19 vaccine triggered an immune response just as effective in the elderly as younger adults. Since the beginning of the pandemic, health experts have warned older people and those with pre-existing conditions are at a higher risk of severe illness from the virus. Internal medicine Dr. Shoshana Ungerleider joins us now to talk about this. Dr. Ungerleider, so this is really fascinating. How do vaccines work differently as you get older? Are higher doses required?
Yeah, that's right, Vlad. Thank you so much for having me. So we do know that the immune response weakens over time as we get older. And as we see with the flu vaccine, you often do need a higher dose or multiple shots in order to receive the same immune response or to have the same immune response as younger people.
Wow. So how could this make a difference in vaccine distribution? Is there a concern that not all of the COVID-19 vaccines will work as well for some seniors?
Well, I think that's yet to be seen. What we see in this small Moderna study is that the 2 injections given 28 days apart resulted in the generation of neutralizing antibodies that were comparable to those in younger adults. So this is promising news, as you point out, because it shows us that we won't need, potentially with this particular vaccine, more doses for older adults. And this is good news for a population of people that are more impacted by serious illness and death from COVID-19. I will point out, though, that the Moderna study, looked at participants who were mostly white. And so it's important that we look at a broader study population to confirm the results for all adults.
That's an important detail. How can mutated strains of the coronavirus affect potential vaccines? I mean, when we're kids, we get certain vaccinations. They seem, I think, for the most part, to last for the better part of our lives. I don't recall ever getting booster shots from some of the things that I received as a kid, but maybe this will be different with the coronavirus.
Well, Vlad, I think it's yet to be seen. We know that viruses mutate, meaning they change over time. This is typical of all viruses, and the novel coronavirus is no exception to that. At this stage, we can't really predict how this virus will evolve over time or how it may or may not impact vaccine development. But different variants of the novel virus are being studied closely for this reason. One thing that we do know is that the more that viruses are replicating and transmitting, the more they tend to mutate. So actually, it's actually on us to slow down the transmission of COVID with our behavior. So social distancing, staying home if you can, washing your hands, and wearing a mask are all really, really important here.
And so it's so interesting that you say that, Doctor, because we have no idea whether or not this virus will mutate. I mean, I'm just, again, as a layperson, I'm sort of thinking, for example, of polio. We all get vaccinated for polio. When that vaccine was made available, in the 50s, I believe, it seemed to go away, at least in this country. But that might not be the case with something like COVID.
Yeah, we just don't know. We are seeing this virus is mutating. We're seeing that in different parts of the world, different parts of the country. There are different elements that on the capsule of the virus itself that look different in different places. But again, this is a brand new virus. We've only known about it for a handful of months now. So we're learning new things every day, every week. And whether or not it will require multiple vaccines or different vaccine development over time is yet to be seen, but it's being studied closely.
And is seasonality at all a factor?
It's possible. We initially thought that with warmer weather, the vaccine would shift in terms of, just how virulent it was, meaning, how strong the virus was in various locales. I don't think we actually saw that. So again, as the years go on, we will learn a whole lot more about how this virus behaves.
So according to Reuters, the FDA has widened its safety inquiry into AstraZeneca's COVID-19 vaccine. Is this routine? Is this a routine precaution? And I'm guessing this will probably cause some delays.
Yeah, Vlad, the FDA is doing their job by looking into the data from AstraZeneca's COVID vaccine study. They're looking back at data from earlier trials of similar vaccines, really in an effort to keep people safe. So it's likely there will be additional delays for this particular vaccine candidate, but that's actually a good thing. So it means the process is working. We need to take this process slowly and uphold the highest levels of scientific rigor to find a safe and effective vaccine here.
There's a recent analysis that found that hydroxychloroquine was associated with higher rates of various heart problems. I'm surprised that people are still talking about hydroxychloroquine, but how could this potentially affect the underlying research and the credibility of the FDA, who initially issued an emergency use authorization for the drug?
Well, Vlad, we've known for a long time that hydroxychloroquine can cause dangerous heart rhythm problems and many other complications. In medicine, anytime we consider starting a patient on a new drug, we use our medical expertise to give careful consideration to the evidence first on that drug's efficacy to treat, any kind of condition, and then we carefully weigh any risks and benefits of the treatment. So I think in the case of hydroxychloroquine, I believe what we saw here was tremendous political pressure by the White House to advocate for an unproven and potentially dangerous medication to be used. So just like much of the COVID response from this administration, selfish political interests have taken precedent over the health and safety of the American public.
What's so fascinating about hydroxychloroquine, when I was a foreign correspondent based in Africa, before I left, my doctor gave me a prescription, a long-term prescription for hydroxychloroquine, and he took me through the sort of side effects and the potential risks. And I remember, at one point I said, so you're basically saying that I could have these risks as you just laid out for us, doctor, or run the risk of getting like cerebral malaria and having my brain explode from like catching malaria from a mosquito. And he was like, yeah, I would probably do it for 2 weeks and then maybe take a break and then make sure you wear a lot of bug spray. And I was aware of the risks even then, and I was prescribed that medication for a very specific reason, which in the past, which I believe it is still prescribed for, malaria, anti-malaria.
That's exactly right. So this drug has been around a long time, has various uses, including malaria. And that's exactly what we do in medicine. We talk to our patients about risks and benefits. We don't just, tout the use of a medicine without it being sort of rigorously studied and understanding all the potential side effects before using it. And we did not see that in the case of hydroxychloroquine and COVID, unfortunately.
Let me ask you about this new study from researchers at the University of Texas at San Antonio that found that the coronavirus can live in the air much longer and travel farther if conditions are not windy. This is, when I see people at restaurants, even though they're outdoors, I worry about the servers, the waiters, the bartenders. How does this affect the way we think about the spread of COVID-19?
Well, Vlad, it's more information for all of us. So this is more evidence that staying outdoors away from others, where there's wind or good airflow is really best. It reinforces the fact that even outdoors, maintaining distance from others, mask wearing and washing our hands are all critical as this country reopens. I think thinking about these things is incredibly important when we evaluate or think about risk in terms of our behavior. So the tools that we have right now are our behavior. So maintaining distance from others, mask wearing, and washing our hands are really on us right now to fight COVID-19, and it's on all of us to do our part.
Yeah. I'm sure I look like a crazy person when I'm in Central Park and I'm zigzagging as I'm trying to avoid even coming within 12 feet of people, especially dudes who don't wear their shirts running. I don't understand the point of that. Dr. Shoshana Ungerleider, as always, enjoy talking to you. Thanks so much for the information. We appreciate it.
Thank you for having me.